I think the most important thing we do for the community is take care of the community when they need us. I think that the connection we have is incredible, and we get such positive feedback.
I walked in the door, I felt so at home. People were so gracious to me. A year ago, I developed severe back problems. I couldn't even get out of bed. Came up here, was still in severe pain. Dr. Lee had an office here in the hospital, and he and his staff were wonderful. I'm going for therapy, and I've been really pain-free.
When you're in larger hospitals, patients may have a nurse that they see one shift and never see them again. A lot of positive feedback that I get from patients is the fact that they have the same nurse throughout their entire hospital stay, or at least the same few nurses throughout the hospital stay.
I've had some amazing conversations with the patients and the residents, and I think sometimes we can get overwhelmed with what's happening on the national stage with healthcare and what's happening in the state. And if you just knock and then walk into a patient's room, they just tell you some amazing things that you're doing here that you didn't really have a concept of.
When you're just visiting, you don't understand anything. You have to come here, I think, and be a patient and see what they do and how they operate and how they get along together. One of the nurses that I know personally is Jamie Glad. He used to be my next door neighbor.
I get up every morning and I come into work, and it's not like work for me. This is an enjoyment for me. It's a very deep feeling I get when I come in every day and I can put a smile on an elderly person's face. I know I made a difference in that person's life.
Everybody that comes in here is in some sort of crisis, so it's important to make them feel safe and well cared for.
Everybody has their own burdens that they bring in with them. And so if you understand that nobody's walking in here pristine, it kind of helps you to take care of them a little bit, to understand if somebody's anxious or angry, there's a reason for it, and you can work with it.
We have a Brave Kid lunchbox, and inside of it is a Brave Kid cape. There's stickers, there's pictures, there's all kinds of little things to keep the kids busy before they go for their surgical procedure. We even had a little boy wear the cape to the OR, and his dad was also kind enough to put the cape on. On another occasion, we had a man come from Plattsburgh for surgery, and it was his 65th birthday. So we got a nice blueberry muffin, put a candle in it, gathered round, sang happy birthday. It was just a nice human touch.
When people think of Adirondack Health, the fact that they think of it as a compassionate organization is the greatest compliment in the world.
Smaller areas usually don't have specialists. This is a unique area in the sense that you have surgeons like myself and my partners. We're attracting patients from all across the North Country because of what I consider to be some of the best health care that can be provided anywhere.
I was sitting with my wife watching the Today Show, as we do every morning, and I looked over at her, and she dropped her coffee cup, and she couldn't speak, and she couldn't move her arms, couldn't move her legs. I knew right away she was having a full-blown stroke. And I knew that I had to get her to the emergency room. Within 20 minutes, I got a doctor on Skype down in Providence, Rhode Island, a Dr. Gaspar. He proceeded to talk to the nurse on duty, talk to the PA, he talked to everybody. He prescribed the medicine, took about an hour, and about 20 minutes after that, she was fine. And she was out the next day at 4 o'clock.
People don't regularly think about healthcare, but it has to be there when you need it. So I think the importance of that, of having a superb healthcare system in the Adirondack Park, is critical to so many things. Our economy, we're an economic driver in the community. It's important to support the tourism industry and the natural resource industry. So it's important not only for being there when you need it, but to all the other pieces. It sort of resonates like a wave.
I think that my story could be repeated thousands and thousands of times with life-saving and with care, We need to have this hospital here.
We have to protect the things that we have so that we have a place to go. This is where I live.
I support them because I want them to stay here. This is a wonderful hospital, and I feel cared for, and I feel like I'm treated as a person. When I walk in that door, I'm not treated like a number.